Hi, and thanks for tuning in to Pregnancy Pearls with me, Dr. Plenty. Today, we're going to talk about something near and dear to my heart, and that is preeclampsia. And the reason that's near and dear to my heart is one, I did my dissertation on preeclampsia, but two, I had a cousin that passed away from complications of preeclampsia. And I didn't really find out why she passed away until much later, meaning when I was on the interview trail for residency, which is interesting in and of itself. She passed away. She was 23 years old. She had preeclampsia and ended up developing complications of preeclampsia called eclampsia, which is a seizure because of preeclampsia. Ended up aspirating, developing pneumonia, and then respiratory distress syndrome that required intubation. Her pneumonia, basically, she couldn't overcome it, and she ended up passing away from respiratory failure because of it. And so it's very near and dear to my heart, and I want to make sure that we all know about it. So preeclampsia, what is it? It is a disease that you can only get because of pregnancy. And I say because of it because you can get it outside of pregnancy. But it's due to pregnancy and the hormones secreted from the placenta that cause high blood pressure and vascular damage. And as a clinician, we look at high blood pressure as anything over 140 systolic, which is the top number, or 90 diastolic, which is the bottom number. And vascular damage is looked at as protein in your urine, okay? In a 24-hour urine sample, it's over 300 milligrams in your urine. So high blood pressure plus proteinuria or protein in your urine is diagnostic of preeclampsia, okay? Now, there are different reasons that people can have high blood pressure outside of preeclampsia and different reasons that people can have protein in your urine outside of preeclampsia. But for teaching purposes, high blood pressure and protein in urine is preeclampsia until proven otherwise. Symptoms of preeclampsia: headache, blurry vision or change in vision, and pain over your liver. So pain in the upper right side of your belly is a symptom of preeclampsia. Now, if you have one or all three of those symptoms, you should get checked out by your clinician to make sure that your blood pressure is okay and to get some lab work done to make sure nothing else is going on outside of preeclampsia. In addition to the symptoms of preeclampsia, we're going to talk about how we treat it. We're going to talk about risk factors. We're going to talk about ways you can reduce it. So let's first talk about risk factors. We know that 3 to 8% of pregnant women develop preeclampsia. More so African American and people of Latin American or Latina origin. You're more predisposed to preeclampsia. Minorities in general are more predisposed, but those two minority groups have a higher risk. Being obese is a risk factor for preeclampsia. Having diabetes, high blood pressure, or any autoimmune disease like lupus or hypothyroidism, those are risk factors for preeclampsia. And if you've ever had preeclampsia in a past pregnancy, we know that that puts you at risk for preeclampsia during future pregnancies. And I want to add that in light of the pandemic, COVID itself is a risk factor for preeclampsia now. So we are seeing that more women that test positive for COVID-19 are diagnosed with preeclampsia, which only complicates the situation. So that's another reason to wear your mask when you're leaving the house, because we don't want to have to balance preeclampsia and COVID-19 because they are managed very, very differently. One, COVID-19, we're trying not to deliver you, whereas the cure is delivery with preeclampsia. So what can you do to reduce your risk? Preeclampsia can't really be stopped, okay? So once you get it, you can't go backwards and unget it. But taking baby aspirin, if you have any of those risk factors that I just named off, can help reduce your risk of preeclampsia. And depending on when you started, the earlier you started, the greater that risk reduction. We know that the optimal time to start it is between 12 and 16 weeks for risk reduction, but the studies say that there's some benefit even up to gestational age of 24 to 26 weeks. So if you're pregnant right now, you have any of those risk factors, talk to your clinician about being on aspirin for preeclampsia risk reduction. Other things that you can do to reduce your risk of preeclampsia is before you get pregnant, making sure you optimize your health. So if you have high blood pressure, making sure that you are very well controlled, even off of blood pressure medicine or on safe blood pressure medicines before the pregnancy will reduce your risk. Losing as little as 10 pounds before the pregnancy, if you're obese, can also reduce your risk. Making sure your diabetes is very well controlled reduces your risk, and making sure your autoimmune disorders are very well controlled and you're asymptomatic for at least a year. With some autoimmune disorders, even up to 18 months, we recommend, would also reduce your risk of preeclampsia. Now, we want to make sure that if you have risk factors for preeclampsia, and even if you don't, making sure you pay attention to the warning signs and getting diagnosed very, very early is the thing that's going to make a difference in your pregnancy. So when you hear about celebrities having very bad experiences in pregnancies, most of the time it's because of preeclampsia or something encompassed due to preeclampsia. There's recently a YouTube star named Nicole from London, within the last couple of weeks, died. Now we know that her family is saying it was because of a heart attack, that likely was because of preeclampsia. Things that preeclampsia can lead to are heart attack. If your blood pressure is really high, it can cause you to have a stroke. Pre means before. Eclampsia is also a bad thing that can happen. Eclampsia is when you have a seizure because of hormones secreted from the placenta. Now, we can also have other things that happen, like you can have a stillbirth because of preeclampsia, or you can develop HELLP syndrome. Now, some people, and let me preface, HELLP syndrome is when you have high blood pressure, elevated liver enzymes, and low platelets. That's what HELP stands for. Some people think that they're two different disease processes. So preeclampsia is over here, and HELLP syndrome is a completely different disease process. And then you have some people that think that HELLP syndrome is on the spectrum, meaning it's a really severe form of preeclampsia. Regardless of what you think, we know that, and we all agree, preeclampsia is at least a risk factor for HELLP syndrome. If you develop HELLP syndrome, that means that you need to be delivered pretty quickly. HELLP syndrome, meaning when your liver enzymes are high and your platelets are low, that puts you at risk for what's called disseminated intravascular coagulopathy, or what stands for DIC, and that leads to a very high chance of passing away. So if you have a 30% risk factor for that with HELLP syndrome, obviously you need to be delivered before you get DIC, which can cause some debilitating side effects as well as death. Other things that we have to consider with preeclampsia is the gestational age and how we're going to manage you. So if you have severe features of preeclampsia, meaning you have severe range blood pressures, and what I mean by that is your blood pressures on the top, or your systolic number, is over 160, and your diastolic value on the bottom is over 110, that alone is a severe feature. And if you're already far enough in your pregnancy, and meaning at least 34 weeks, then that would mean that you need to be delivered pretty urgently, okay? If you also have elevated liver enzymes or low platelets, even if it doesn't meet the diagnosis of HELLP syndrome, if you have evidence of renal issues, meaning your creatinine is elevated, those would be reasons to be delivered even before 34 weeks. If you have high blood pressures and we just can't get your blood pressure down, that also would mean you need to be delivered. And obviously, if you have symptoms, headache, blurry vision, or pain over your liver in the upper right portion of your abdomen or belly, those are symptoms of severe disease, and that would necessitate delivery. Sometimes the baby necessitates delivery. So preeclamptic women have an increased risk of having smaller babies because we know that hormones at the level of the placenta cause this. And we don't know exactly which hormones. We know that a lot of hormones play a factor, but we know that it's something caused by the placenta. The placenta gives the baby nutrients. So if the placenta is not functioning the way it should be, then yes, you do have a high risk of your baby being smaller. If the placenta is functioning so poorly that we start seeing abnormal blood flow through the umbilical cord, that could be a sign that this baby may be passing away pretty soon. That would mean that you need to be delivered before 34 weeks or at the time of diagnosis, because we don't want you to have a stillbirth. As a clinician, what we battle with preeclampsia is how far do we get the mom safely to prevent her from having anything like a heart attack or a stroke or going into DIC versus how far can we get the pregnancy so that your baby won't have prolonged NICU stay and complications of prematurity, like respiratory distress syndrome or learning disabilities or little strokes that babies can get in the brain. So it's a fine balance. The average gestational age for preeclampsia is around 29 to 30 weeks of pregnancy. So that's why it's a fine balance of how far can we keep a mom pregnant versus when is it a good time to get out for the benefit of mom and baby. If you have severe features, it means you need to be in the hospital. And I talk to people all the time about this. They're like, Dr. Plenty, I feel fine. It doesn't matter if you feel fine because preeclampsia acts in such a way that your blood pressures are like a yo-yo. They're up and down, and they're very unpredictable and they can be labile. 1 minute your blood pressure can be completely normal. The next minute your blood pressure is 180 over 110. And so because we can't control that, if we see risk factors and we see that you have abnormal labs already or you have elevated blood pressures, we need to get you in the hospital. It doesn't necessarily mean you need to be delivered immediately, but it does mean you need to be in the hospital. And if you're over 34 weeks with severe features, you do need to be delivered. If you're under 34 weeks, then we have to say, okay, can we keep this person in the hospital until they develop symptoms that are consistent or until they have lab work that shows us, hey, now we're moving towards being in the danger zone. Now we have to get out. The other reason that we need to monitor you in the hospital is because we need to monitor your baby. Like I said before, preeclamptic women have an increased risk of stillbirth and having smaller babies. So because of that, we need to monitor your baby frequently, which will require you to be in the hospital. Now, if you don't have severe features, meaning your blood pressure is under 160 on the top, or your systolic value, or under 110 on the bottom, or your diastolic value, and your labs are completely normal, and your blood pressures are controlled consistently after being monitored, then yeah, you can be monitored outpatient and basically be seen once or twice a week. Your labs are monitored periodically to make sure they're still normal, and you can be delivered at 37 weeks if you never develop symptoms and you never have any lab abnormality. But it does mean you need to be monitored closely to make sure you don't develop any of those severe features, okay? Very important, even if you feel good, because this is unpredictable and the complications are unpredictable, you need to be delivered, okay? I argue with people all the time because I want you to be safe. And when we talk about maternal mortality and morbidity, a lot of that has to do with complications of hypertensive disorders of pregnancy, bleeding, and all of that can stem sometimes from preeclampsia, under recognition of preeclampsia, and not being treated aggressively because of preeclampsia. So I urge you, if you have that, then please follow the direction of your provider. If you have any concerns or you have any symptoms, always reach out to your provider, even if you don't have preeclampsia. Reach out to them. Let them know, hey, I have a headache, so they can bring you in and check your blood pressure. Or go ahead and check your own blood pressure and make sure it's not severe, but still let your OBGYN know that you're having symptoms, okay? Most of the time, if you have preeclampsia and you're very early, you will be seeing somebody like me in conjunction with your OBGYN. I'm a maternal fetal medicine specialist, and we would basically make the decision about when you need to be delivered. If you're already over 34 weeks, or especially if you're already full term, your OBGYN may deliver you without consulting somebody like me, which is appropriate, okay? But just making sure you know the questions to ask. You have high blood pressure, ask about it. Ask about preeclampsia. Ask about being on aspirin to reduce your risk if you have any risk factors that we just talked about. You're your biggest advocate. And sometimes your OBGYNs, we're not perfect. Sometimes it may slip our mind. So make sure you're being diligent and advocating for yourself and asking about these things so that you can get through your pregnancy uneventfully and healthy. Also, I want to stress, make sure you prepare for your pregnancy, optimize your health, lose weight if you're obese before you get pregnant. That in itself will reduce your risk of having complications during the pregnancy. As always, If you have not clicked the subscribe button below, go ahead and click the subscribe button and follow me on my social media platforms. I'm on Instagram at pregnancy_pearls, and I'm on Facebook at Pregnancy Pearls. And obviously, this is my YouTube channel, which is now Pregnancy Pearls with Dr. Plenty. Until next time, bye, you guys. Stay safe.